So type me yes if you can see me and we are live. What we will aim today is to discuss the NEETPG or NBE type paper trend so that you get an idea in future also what type of questions you might get and what are the important topics they are focusing. So everybody have their notes with you, but not more people know how to study, how to obtain maximum out of your notes. So this is very important for you to know how to utilize the material that is available to you, because now everybody have everything available online. So everything there is in your telegram group and all, but the problem is you cannot read everything, each and everything, and go in your exam. So you have to read only that much that you can produce in examination. So I think I should start our session. So let us see some biochemistry question and get an idea what they are wanting to ask. If you see this question that is right in front of you is, they have asked you about a syndrome called Zellweger's syndrome. So they want you to know whether you know which enzyme is deficient or which organelle is absent in this syndrome. So you all know that there are set of peroxisomal disorders where either whole of the peroxisome organelle is absent or one particular enzyme in peroxisome is absent, right? So Zellweger syndrome is also called cerebrohepatorenal syndrome. So it is also an inborn error of metabolism, you can say. So the topics, you can get an idea that you need to know certain syndromes that are arising out of enzyme deficiency. So if you know that this Zellweger syndrome is a peroxisomal deficiency disorder, you straight away can answer this question. You need not to know that which enzyme is deficient, which gene is affected. So what is happening here is the gene, that is PEX family of genes, are absent, and finally what happens is the light chain fatty acids accumulation occur. So if you see a generalized overview over the peroxisomal disorders, just give me a sec. So what we are going to see is what all cycles occur in peroxisome, right? So and why it is important to read about peroxisome and the disorders. Fatty acid oxidation, S2O2 detoxification, bile acid synthesis, plasmalogen synthesis, cholesterol synthesis, glyoxylate detoxification. These are the enzymatic processes that occur in a peroxisome. And if a peroxisome organelle is absent from the cell, these all metabolism will be affected. And what all it can cause is, it can cause certain disorders. So 16 types of peroxisomal disorders are there, out of which 15 are autosomal recessive and one is X-linked, that is adrenoleukodystrophy. So only one peroxisomal disorder is X-linked, and that is why it is important for you for future to know about this adrenoleukodystrophy, right? So two pictures you can see. The above one is due to deficiency in beta oxidation of very long chain fatty acids and adrenoleukodystrophy. The second one is Zellweger's syndrome. So adrenoleukodystrophy, for your future exam, it is the most common paroxysmal disorders that occurs, and what happens is basically the child will present with ADHD, new onset school deficiency or difficulties, visuospatial deficit, ataxia, seizures, hypoglycemia. So these were some of the symptoms of adrenoleukodystrophy, and this is your Zellweger's syndrome, where you will get a picture like this, and there will be dysmorphism, that is large frontal. If you see this figure, the baby with the large frontal, high forehead, abnormal ears, microignitia, low and broad nose, reductant skin folds, ocular abnormality, liver. So that is why it is called cerebrorenal disorders. So if you see this, the computer is little slow. So it is called cerebrohepatorenal syndrome, right? And one more important thing is, yeah. Then we'll move to another question that is from a amino acid, that is urea, creatinine, nitric oxide are formed by which amino acid? So amino acid is another important topic with regard to biochemistry, and in biochemistry you need not to go in too much depth. Only thing that you need to do is at least revise the important cycles, whatever cycles you have, whatever enzyme deficiency syndromes and the inborn errors of metabolism. So you can summarize your biochemistry and just read and keep on revising important things, because most of your questions will be from only them. So here again you need to emphasize and revise your amino acid portion, because every year there will be something from amino acid. So here arginine is the one which is providing its nitrogen for the formation of urea, creatinine and nitric oxide in the urea cycle. So urea cycle is a basic cycle you all know, and you should revise it again for your exam. Now your next question is from mitochondrial DNA. So if what they want you to know is, because this mitochondrial DNA is something different from the normal one, that is why they have asked this question. So all are true regarding mitochondrial DNA except all respiratory proteins synthesized within the mitochondria itself, double-stranded, high mutation rate, inherited from mother. So some points are very clear that it is inherited from mother, there is high mutation rate, and it is double-stranded. But it is not always that all the enzymes are synthesized in the mitochondria. So some important characteristic that you should know is it is circular, double-stranded, composed of heavy and light chain of strand, contain 16,569 base pairs, right? Encode 13 proteins subunits that has NADH dehydrogenase, cytochrome B complex 3, cytochrome oxidase, that is complex 1, complex 3, complex 4, and ATP synthase. So these are the enzymes that are synthesized inside it or by it, right? So certain characteristic of mitochondrial DNA that you should know are important, and it is inherited as maternal inheritance. Again, if you see, they have asked from the amino acid only, which amino acid is used to synthesize nitric oxide, and again it is arginine. So emphasizing the topic that amino acid is really and pretty important for you. Which apoprotein is responsible for Alzheimer's disease? So another important topic is the apoenzymes. So there are some deficiency, or there are some diseases where these apoenzymes are deficient. So in Alzheimer's it is apoenzyme E4, right? So nothing more or to learn with regard to biochemistry. and Alzheimer's. You can read about Alzheimer's in medicine more and apoenzymes from the biochemistry. So ApoE4 is the major risk factor for the Alzheimer's disease, and ApoE2 gene is reducing the risk of Alzheimer's disease. E4 is increasing the risk factor and E2 is reducing the risk factor for Alzheimer's disease. Okay. Now Menkes disease is associated with which enzyme deficiency? So it is a straightforward question, that is lysyl oxidase. And what all you will see in Menkes disease? You will see kinky hairs, growth retardation that occurs due to dietary deficiency of copper, which is an essential cofactor of lysyl oxidase, right? And what else occurs in Menkes disease is defect in ATP7A. LCAT deficiency increases the following. So again from lipids, so lipid metabolism, so it occurs due to HDL. So basically if there is LCAT deficiency, it will result in HDL accumulation. Now seeing the overview for other topic, very straight and very easy question. This they are asking about beriberi. Let us see the question. A 25-year-old alcoholic presented with edema, hypertension, ocular disturbances, changes in mental state, high output cardiac failure, and they have diagnosed it. They have given the diagnosis as wet beriberi. Even if they do not give the diagnosis, you can fetch from the history that the patient is alcoholic and is having mental state changes with ocular disturbances. So straightway it is due to deficiency of vitamin B1. So beriberi can be two types. One is wet beriberi and another is dry beriberi. So wet beriberi is in wet beriberi the most prominent symptom are the cardiovascular manifestation. Okay, and other will be like other findings will be palpitation, breathlessness, distended neck veins. In dry beriberi, the major manifestation will be from CNS like delirium, sensory disturbances, peripheral neuropathy and all, neuritis and all. Okay, and the Wernicke-Korsakoff syndrome, that is cerebral beriberi, when things got even more worsen, it will present to you with encephalopathy, ophthalmoplegia, cerebellar ataxia and psychosis, right? Again a question from this cycles, that is glutamine is increased in CSF, blood and urine due to deficiency of. So this ornithine transcarbamylase deficiency or hyperammonemia type 3 is the only urea cycle disorder which is inherited as X-linked and causes the increase of glutamine in CSF, blood and urine. So again urea cycle, you should know what is the disease caused at every step, at every disorder or at every deficiency of the enzyme. So biochemistry is pretty easy, you need not to worry much. Just focus more on the important stuffs. I am again repeating, the syllabus is huge like anything. You cannot cover everything, but at least try to cover the important part so that you don't miss on the stuffs that your other competitors are knowing, right? So even each coaching institute, they are not going to cover whole of the ENT, whole of the medicine. What they do is they just make notes for the last 5-year examination questions and all. So they give you some high yield topic, high yield stuffs in the form of notes so that you get to know the most important thing. So nobody can study a syllabus fully, but what you have in your hand is to cover up the important things, and that is why I am discussing some of the important questions from the previous year recent papers, right? So type of cholesterol present in a gallstone, it is crystalline cholesterol monohydrate. So anyway, these stones, the cholesterol stones, these have basically cholesterol monohydrate crystals, calcium, bilirubinate, and bile salts. So these are monohydrate mostly. So cholesterol stones, 80% the gallstones are yellow green in appearance, and 80% of gallstones are cholesterol stone. Now there, in every alternate year they will ask one question from the type of collagen. So you can just Google and know different type of collagen that are present in different parts of the body. So like here they have asked collagen present in skin is. So it is type 1 collagen. So it is easily available in your books, in your over the Google. Just browse through it, because reading whole the table will increase the time just, but you need to remember it, so you can write it down in front of your study table or over the chart paper that I told to stick on your study table, right? So which of the following is not a ribozyme? So they are basically, ribozymes are the RNA enzymes. So you have to find which of the following are not RNA enzyme catalyzing the certain process, certain steps. So ribonuclease is a ribozyme, poly A polymerase, transpeptidase, peptidyl transferase. So if you see here, the answer should be poly A polymerase, because every other things are the enzymes or the protein enzymes or the RNA enzymes. Not protein enzyme but ribozymes. Now let us see the trends from pharmacology, because pharmacology is also a very important topic and many of you have fear in them. And one more important topic is hyperlipidemia. So like this they have asked type 1 hyperlipoproteinemia is characterized by. So likewise you should know all the types of hyperlipidemia and the hypo one. So type 1 is elevated chylomicron. So you must have that chart in your notes or somewhere. If you have written, just revise and go through it. Now again a question from Krebs cycle, urea cycle, which is saying that in Krebs and urea cycle the linking amino acid is, so it is fumarate, sorry. So urea cycle, it's linked to TCA through fumarate. So you have if you remember the cycle, through the fumarate these two cycles are linked. Now one pharmacology question, some pharmacology questions. So in pharmacology, you can divide your pharmacology into 2 to 3 parts. One important part will be questions from your general pharmacology, that will be asking you about pharmacokinetics, pharmacodynamics. So that part is very important. Don't leave that part where you have discussed about different clinical trials, drug trials, and the basic concept, because they are going to ask minimum of 2 to 3 questions from that part. Another second part you can keep for different antibiotics like beta lactamase, staphylococcus, MRSA. So that part, that will also give you 1 to 2 questions. So that part also you need to maintain. And the third part will be from systemic and the miscellaneous part. Miscellaneous part is your anti-cancer drugs, anti-metabolites, anti-smoking drugs, varnicillin, and also these again newer part, the miscellaneous part which are being skipped by many, is also very important. So here the question is oral factor XA inhibitor is. So again, an important question, and by now you must have known that it is rivaroxaban. So rivaroxaban is a factor 10A inhibitor, and thus it acts as an anticoagulant. Now this is a pretty interesting question which gives you a clinical scenario, a condition which says that a nursing mother presented with fever and breast tenderness after 2 weeks postpartum. Which oral antibiotic is ideal for her? So you have to first identify what they are wanting to tell you. So they are wanting to tell you that there is infection with staph. So the puerperal mastitis is a skin and soft tissue infection that is caused mostly by staph aureus that occurs in 1 to 3% of nursing mothers. So once you know that it is staph, the answer becomes easy for you. So the answer will be dicloxacillin, which is an acid stable beta lactamase resistant anti-staphylococcal penicillin. So answer here becomes your dicloxacillin. Okay. Now I am having an important call. We'll pause for just a minute. Okay. If it comes again, we'll see. Now moving to some more questions, or we can straightway forward move to some important questions that we have selected, or I have selected for you is these. So one question is there from the X-ray of paranasal sinuses. So it's a straightforward question, but many of people have confusion because recently I have received this query. So if I ask you this occipitomental view with open mouth seen in the image, can you tell me the answer whether it is Waters view, Caldwell's view, Towns view or Perez view? So I am seeing your comments. So it will be a mixed bag mostly. I'm teaching you whatever important I'm finding and whatever important you should know. So answer, can you tell me the answer here? Waters view, Caldwell's view, Towns view, Perry's view. So this is one of the questions from your recent examination. And this is another X-ray with closed mouth. So answer here is Perez view. And if you see this X-ray of occipitomental view, answer here is Waters view. So what is the difference? Difference is just the closing and opening of mouth. Here you can see two sphenoid sinus through the open mouth, and this is the Perez view. In Waters view, if you ask me how the patient is there, the patient is seated facing that plate, and this occiput and the nose is touching that metallic. So mentomeatal line should be perpendicular to the film with the mouth closed in Waters view, and this is with mouth open is Perez view. So don't forget, they can also give you another view where the patient is with the chin and nose. So this is Waters view if the mouth is closed, as you can see here, and if the mouth is open, it will be Perez view. Now what others view are there? Waters view, you already know, it is occipitomental, which is best for maxillary. Caldwell's view is frontal, best for frontal. Rees view is lateral oblique for ethmoid. Base of skull view is sphenoid. Lateral view, Perez view we have already discussed. So these were some important views. Now let us see some other questions also. And one more is the Towns view. So in Towns view, what you can do is you can see both of the petrous part of the temporal bone. So it shows the foramen magnum in center with the dorsum sella projecting to it. So this is your Towns view, where the view will be like this. So it will be 30-degree caudal tilt. Okay, so this figure is for Towns view. Here you can see both the petrous part of temporal bone. Now another important question that was asked was regarding the cells in the paranasal sinus CT scan. So there is some lag with my laptop, excuse me for that, but let us see whether we can reach to that question. Yes. So the question they had asked is ki anterior most, they have asked anterior most ethmoidal cell. So if they have asked you or given a CT scan where you can see that the anterior most cell is the ethmoidal air cell is the agar nasal, while the biggest or the constant most ethmoid air cell is bulla ethmoidalis, right? Bulla is also an anterior ethmoid cell, but agar nasal cell is more anterior to your bulla ethmoid cell. So anterior and posterior ethmoid cells are separated too. So that I have already discussed that there is a part of middle turbinate which goes and attaches to the lamina papyracea. So that is called ground lamella or basal lamella. So this ground lamella or basal lamella separates the anterior and the posterior ethmoid air cells. And here also in CT scan you can see that this is the anterior-most agar nasal, anterior ethmoidal, posterior ethmoidal, then sphenoid sinus, and here you can see pretty clear ground lamella or basal lamella which is going to attach at the lamina papyracea. So this is your orbital cavity, cone-like orbit. This is the lamina papyracea thin bone where this basal lamella or ground lamella is separating the anterior for posterior ethmoidal cell. The last thing that would I revise for you for today's small session is the anterior ethmoidal artery. So this endoscopic view is showing you the anterior ethmoidal artery exiting from the orbit into the nasal cavity between two muscles. So if you see this CT scan of nose and paranasal sinus, this anterior ethmoidal artery exits from the orbit between medial rectus and superior oblique. Okay, and this part is called Kennedy's nipple. So don't forget it. This will be your future question in your coming exam. So this is your anterior ethmoidal artery. If somehow they mark it, this is your superior oblique and this is your medial rectus exiting through the orbit. Okay, so I think for today I'll keep it very short, and just for revising, this is your Kennedy's nipple again, and here you can see anterior ethmoidal artery. One important instrument that was asked in your examination was your Mollison's mastoid retractor. So I think everybody of you knows, and if you don't know, this is used in mostly in mastoid surgery or tympanomastoid surgeries like tympanoplasty, mastoidectomy, head neck surgeries like tracheostomy and laryngofissure. And it is called Mollison's self-retaining hemostatic mastoid retractor. So I think I should end this session. I have to receive an important call. But anyways, we have discussed a lot more trend and the important stuffs for today's session. Till then, stay happy, keep giving your efforts, and you will achieve the thing you are working for. This is Dr. Shivam. Stay healthy and stay happy. Bye.